Welcome to the Explainer. Okay, let's just jump right in. What if the best medicine for your aching knees wasn't in a pharmacy, but was actually flowing through your own veins right now? Today, we're diving into a really fascinating treatment for knee osteoarthritis that does exactly that. It uses your own blood to fight pain and inflammation.
So let's cut to the chase. The big idea we're exploring is, honestly, it's pretty profound. Can we actually tap into our body's own natural healing toolkit to fix one of the most common causes of chronic pain out there?
But before we can really appreciate the solution, we have to understand the scale of the problem. Knee osteoarthritis isn't just a little ache or pain. For millions of people, it's a truly debilitating condition that can just ruin your quality of life. And the worst part? It's getting more and more common.
So yeah, this really sets the stage for our whole discussion today. We're looking at this new therapy because for so many people, the treatments that are already out there, well, they just aren't cutting it.
Okay, so what are the current options? Well, the two go-to injections have been corticosteroids and hyaluronic acid, but they both have some pretty big drawbacks. Steroids, for example, can give you some quick relief, but over time, they can actually be toxic to your cartilage, and the relief doesn't last. Then there's hyaluronic acid, which, believe it or not, can sometimes cause the very pain it's supposed to treat. And the studies on how well it works, they are all over the map. This is exactly the gap that this new treatment is trying to fill.
So, what's the alternative? This brings us right to the heart of the research we're looking at today. It's a treatment called Autologous Conditioned Serum, or ACS for short.
I know, the name sounds super complicated, but the idea is actually really simple. Autologous just means it comes from you. That's it. It's a special preparation made from your own blood, which then gets processed to concentrate all the good stuff. We're talking anti-inflammatory proteins and growth factors that your body already makes naturally.
So how do they actually do it? Well, it's a pretty cool four-step process. First, they just draw some of your blood, pretty standard stuff. Second, they mix that blood with these special glass beads. Now, this is the clever part. The beads basically trick your white blood cells into producing a flood of these powerful natural anti-inflammatory proteins. Third, they spin the whole thing in a centrifuge, which separates out this super concentrated healing serum. And finally, that golden liquid gets injected right back into your knee, from your arm to the lab and back to your knee.
And this really gets to the heart of it. Think of an arthritic knee like a battleground. You've got these bad guy proteins, called cytokines, that cause all the inflammation, pain, and damage. But your body also has good guy proteins trying to fight them off. This ACS treatment is kind of like sending in a super squad of reinforcements for the good guys. They swoop in and block the bad guys from causing any more trouble.
Okay, so the science sounds amazing, right? But the real question is, does it actually work in real people with real knee pain? To figure that out, the researchers we're following did a deep dive, a systematic review of all the clinical studies they could find.
And after sifting through multiple databases, weeding out duplicates, and tossing out irrelevant papers, they finally zeroed in on 15 clinical studies that looked at exactly this, the effects of these serum treatments on patients with knee osteoarthritis. And what they found? Well, it's pretty compelling. What you're seeing here is a summary of how many studies reported positive results. They measured this in a couple of ways. One is just a simple pain scale. The other is something called the WOMAC score, which is a bit more detailed. It asks about pain, stiffness, and how well you can do daily tasks. And as you can see, the vast majority of these studies showed that patients really did feel and move better after the treatment.
Okay, so it seems to help with pain. But that brings us to the next massive question, maybe the most important one. What are the risks? Is it safe?
Well, the good news here is that the most common side effects were pretty minor and temporary. We're talking about things like a little bit of swelling, some stiffness, or pain right at the injection site. Basically the kind of thing you might expect from any knee injection. And it usually went away on its own pretty quickly.
And here is the absolute key takeaway on safety. Serious complications? Incredibly rare. Across all 15 of those studies, which included more than 1,000 patients, there was only one single reported case of a serious joint infection. That's it.
But look, this is science, and it's always important to be skeptical and ask tough questions. And this research review also pointed out some major gaps in the evidence, things that stop us from calling this a total slam dunk treatment just yet.
And this is a big one. Osteoarthritis is a chronic, long-term condition, right? So a short-term fix isn't really a fix at all. What everyone wants to know is, how long does the relief from this injection actually last?
And the honest answer is, we're not really sure yet. The results were just all over the place. Some studies found patients felt relief for only 3 months. Others reported benefits lasting up to 2 years. But the biggest problem is that we just don't have enough long-term data. Only one of these studies even bothered to check in on patients after that 2-year mark.
And here's another thing that, honestly, is kind of surprising. It turns out there is no standard, agreed-upon recipe for how to actually give the treatment.
Just look at this. It really shows how much variation there is. For the ACS treatment, some doctors gave 3 to 6 smaller injections over a few weeks. But for the very similar APS treatment, they used just one single larger shot. How can you compare results when everyone's doing it differently? With no standard protocol, it's almost impossible to figure out what actually works best.
So, where does all of this leave us? We've seen some really promising science, some positive signals from clinical trials, but also some pretty significant unanswered questions. So what's the final verdict from this deep dive into the research?
I think the author's own conclusion really sums it up perfectly. They say that the data suggests these treatments may improve pain and function, and that they do it with limited risk. And that word, may, is so important. It's a sign of cautious optimism, not a guarantee.
So here's the bottom line. This idea of using our own blood to heal our joints is genuinely promising. It taps into the body's own amazing ability to fix itself. But before this can become a go-to, mainstream option, we just plain need more evidence. We need bigger, better-designed clinical trials that follow patients for much, much longer.
And that really leaves us with a final thought to chew on. This type of therapy is part of a much bigger shift towards personalized medicine. It raises a really fascinating question for the future. As our understanding of our own biology gets deeper and deeper, will we increasingly find that the most powerful, most precise, and safest pharmacies are the ones we carry around inside our own bodies?